Good day, Professor. My name is Lim Yen Ying.
Hi, my name is Yang Shuming.
My name is Zhong Zhong En.
My name is Jia Peijun.
I am Do Hyun Lee.
Hi, my name is Yu Pei Jing.
Okay, so today we are going to talk about the pandemic COVID-19. The coronavirus disease, so called as COVID-19, is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. So that means there's no medicine to treat this disease. Older people and those with underlying medical problems like cardiovascular disease, diabetics, chronic respiratory disease, and cancer are more likely to develop serious illness. As of until today, 21st February 2021, more than 111 million cases have been confirmed worldwide, with more than 2.46 million deaths attributed to COVID-19. On the 24th January 2020, there was the first case of COVID-19 is first detected in Malaysia and traced back to 3 Chinese nationals who previously had close contact with an infected person in Singapore. So in March 2020, the number of reported cases in Malaysia grew relatively slowly until a religious event took place at Sri Petaling, Kuala Lumpur, which had led to an exponential rise in cases. With this, our government have taken several actions to stop the COVID-19 spread, and that's when the MCO start.
Today, I would like to present my idea about the Malaysian Movement Control Order MCO 1.0, which was implemented throughout Malaysia effective from 18 March 2020 until 31 March 2020. The MCO provision was declared by our Prime Minister on 16 March 2020 due to the cases of COVID-19 had increased in our country with 190 cases on 15 March and 125 cases on 16 March 2020. The economy and society activity was strictly not allowed during MCO 1.0 except supermarket and industry that involve its essential service such as industry, telecommunication, post, transportation, health, banking, and food supply. In my opinion, the sudden stop of operation for other industry have bring much impact to their business because they are unable to plan their delivery to customer, especially the company selling goods to overseas country. It caused company lost the main income and difficult to bear so much employee and last decide to dismiss them. Besides, the small and medium enterprise also facing a big challenge for a long term. They need to settle down the old stock, rent payment at the situation with no income. According to our Human Resource Minister, there are around 2,000 SME closed down between March until October 2020. Indirectly, this has caused people become unemployed and bring impact to social problems and mental health as well due to the finance stress. But so glad our government had done some effort to solve the economic problems and succeed to reduce cases of COVID-19 during MCO 1.0.
Along with Sherman's sharing, I would like to talk about the extension of the Movement Control Order MCO, which was firstly implemented since 18th of March 2020. On 25th of March 2020, the Prime Minister has announced the first extension of the Movement Control Order to 14th of April through a national live broadcast. People are prohibited of mass movements and gathering across the nation, including religious, sports, social and cultural activities. To enforce this prohibition, all houses of worship and business premises will be closed except for the convenience stores, supermarkets, and grocery stores which selling everyday necessity, as well as the essential services such as water and electricity, transport and postal, banking and finance, health and pharmacies, and so on are allowed to operate. The Chamber of Attorney General released a Federal Gazette specific to the Movement Control Order on 18th of March 2020, where violation can be fined up to 1,000 ringgit Malaysia and or jail not more than 6 months or both. During the MCO, the Royal Malaysia Police conducted roadblocks operations along key points across the country to monitor the travelers and warn people to stay home and abide by the law. As we can read from the news, there are numbers of people being penalized due to the violation of the law. Basically, I agree to this, the implementation of this MCO, as everyone in this country should be obeyed to it. This is because it is important to avoid the spread of the virus. As we can read from the news, there are numbers of people being penalized because of the violation of the law. Basically, I agree to the implementation of this movement control order, and everyone in this country should obey to it, as it is important to avoid the spreading of the virus in our country.
After MCO finished, Malaysia government was changed to Conditional Movement Control Order, that is CMCO. CMCO was started on 4th of May 2020. During CMCO, there was no interstate or inter-district travel will be allowed without permit from police. No tourism and mass gathering such as a wedding will be allowed. For the operation hours for the shops was limited, usually was 10 a.m. to 10 p.m. The food delivery and dine-in was allowed, but limited to 2 or 4 persons per table. There also only 2 households will be allowed to live at a time. During CMCO, also having the Enhanced Movement Control Order, that is EMCO. EMCO usually apply at housing area where COVID-19 cluster has been identified. At EMCO area, the citizen was not allowed to live in their homes or house. They also no visitor prohibition. The all business activity also need to be closed and guarded by armed security force. The EMCO usually will be 2 weeks or will be extended if the case still highest. So the example was on 28th of December 2020, 2 places in Johor and 1 places in Negeri Sembilan has been announced to EMCO. So after EMCO will be changed to Recovery Movement Control Order, that is RMCO. The RMCO was the business will be operation as usual, but the all citizens need to follow the SOPs such as wear mask and having their social distance.
Due to daily infection rates has increased, Malaysia Senior Minister Ismail Sabri Yaakob announced that the Movement Control 2.0 will be implemented from January 22nd onward until February 4 for all states except Sarawak. However, there is a slightly different SOP for business and consumer compared with MCO 1.0. This is because the government is trying to prevent a major impact on both business and consumer parties. The government also allowed 30% of workers are allowed to work in essential industry, while 30% must work from home. Furthermore, students are not allowed to go to school. The government is suggesting online education, where other NGO parties also help to distribute digital devices such as laptops to help those poor students for online education. Dine-in at restaurants is not allowed during MCO 2.0 starting January 22nd until February 10. However, the government has allowed dine-in with 2 patrons from February 10 onward, and then February 18, the government decided to remove the dine-in restriction of 2 to unlimited patron per table with 1 meter social distance.
Last but not least, at advice theory from Director General of Health Malaysia, Dr. Hisham, let us be united in our wars against this current large-scale COVID-19 transmissions. We cannot win this war without the public support. All we ask is for the public to stay at home, and if that is not possible, then please comply to the simple SOP, avoid the 3C and practice 3W. For information, the 3C is about crowded, confined space and the close conversations. And for the 3W is wash the hand, wear the mask, and warn other people. In the SOP, we must maintain at least a 1 meter distance between yourself and others, and make wearing a mask a normal part of being around other people. The proper use, storage, and cleaning or disposals are essential to make the mask as effective as possible. The conclusions of our discussions that I want to tell everyone, although by today already have the vaccine, but not 100% can avoid the COVID-19. The COVID-19 will never disappear, but we have hope. Remember, we are in this together. Thank you.